Well, let's bookend this podcast here, Dad, because in the beginning we spoke about, the TRT, right? And now we're sort of at this point now. Now, in terms of labs, so there's different lab ranges depending if you go to LabCorp, Quest, or West Pacific, or what have you. And it can range anywhere from a normal testosterone of 300 to 1,000 nanograms per deciliter. Some labs are more around, high 200s all the way up to 890. So again, reference ranges can change. I want to make 2 points here. One, I've had lots of men with very low T, like in the 200s, that are asymptomatic. Okay, they don't have the belly fat, they don't have the fatigue, they don't have the muscle loss, they don't have any cognitive issues, they have no libido issues. So I just want to make that point there because it's not all about treating numbers. Okay, and you and I are all about treating the patient. This is personalized medicine, individualized medicine. This is what we're doing. This is the message that we're spreading across this podcast. Now, the other point I want to make is following up on what you just said. Some men benefit tremendously from going on hormone replacement, which is testosterone. Right. And this speaks to the whole andropause thing that we're talking about. In women, it's lowered estrogen and progesterone to some extent. So we give those hormones along with some other hormones. And for men, it's usually low T with andropause. And so we give them testosterone. And not every male responds to it. I've put plenty of men on a cream or injections and they haven't noticed a thing. Okay. And I've had other men that it's been an absolute game changer where they get their brain function back, their libido comes roaring back. They can pump more iron at the gym and feel like they've just got more like vitality and oomph and gas in the tank. And they feel like their quality of life is so much greater because, again, mood changes. Like they notice this elevation in their mood, which can be tremendous. So sometimes with testosterone therapy, it's trial and error. It's just seeing if someone responds to it, maybe within a month, if there's no change at all from doing injections or, compounded cream for that example, then maybe testosterone therapy isn't for you. And ideally, in terms of going back to the range, again, we talked about that, anywhere from 300 to 1,000. I like to see men anywhere around 600 to 700. Yeah, it's kind of a good range. If you go too high, you got to be mindful of erythrocytosis or like a polycythemia where there's too much hematocrit hemoglobin in RBCs in terms of the amounts. And so
by the way, that's a major risk factor in men. I mean, there's so many weightlifters who push testosterone to levels of 1,400 picograms per ml. Yep. And they get thromboembolism. They get blood clots in their deep veins. And, I'll tell you, there's horror stories in young men with thromboembolism to the chest because of DVT. So you're absolutely right.
Yeah. So when you're on TRT, you want to make sure you're getting a CBC done regularly just to check on that. And then also there's two other things that I'm really mindful of when it comes to TRT, and that's prostate health. And so if a man has current prostate cancer or has had prostate cancer, or if there's even some BPH involved too, I don't give testosterone replacement therapy. I'm very conservative there, very cautious because there's some speculation that giving testosterone may feed the growth of prostate cancer or increase the size of prostate cells, therefore leading to a worsening of BPH symptoms. And then another condition too is liver disease. So if there's anything happening with the liver, I tend not to kind of want to prescribe testosterone. But overall, it's a safer hormone to use. But of course, always talk to your doctor first about going on TRT.
No, I absolutely agree 100%.